Welcome back to the Humble Build Healer podcast. Thank you for taking time to check in. And today we'll talk about home medical care tips and tricks, and something that I've learned throughout the years. And this will be the first episode for the home medical care tips and tricks that may save you from a trip to the urgent care or emergency room. So there are things that we learn to do to help take care of patients in the clinic that can also be done at home. So let's start with choking rescue, which is something that actually has resulted in unfortunate deaths in people every year. And I remember this incident when one of my children, she was, I think, 3 at a time, and she was very curious. She found a bottle of vitamin gummy. So she put it in her mouth and ended up choking on it. And she went to me, panicked, and could not say anything. Usually people learn about the Heimlich sign, where you put your fist underneath the victim's ribcage right in the center where the xiphoid process is, and you just pull the fist in. But in kids, you don't have to do that. And actually studies have shown that you can use the back slapping technique, and that's what I did. And you can also use the back slapping technique for adults. In either case, either one works, but the back slapping may work better for you. So that's what I did. I slapped her in the back really hard, and the gummy popped right out after a few slaps. What it does is that it helps increase the pressure in the thoracic area, and it helps force that foreign body or object out of the patient's or the victim's airway, the choke point, where near your vocal cords, where things get a little narrowed, and it can block you from breathing, which is very scary phenomenon. I also read a story one time where there was a young woman, I think in her 20s, and suddenly she collapsed at a baseball game, and people tried to do compression and even finger sweep in her mouth, but could not save the woman, unfortunately. And after the EMS came and the patient, the victim already became unconscious and could not be brought back and resuscitated. And they later on found out she choked on a piece of hot dog deep down in her vocal cord that bystanders did not realize. And because they did not see that she was showing choke sign where you were just pointing at your throat, by the time people realized you already passed out. And but that's something that to consider when you see in public that people start to do that. Check for cardiac arrest, of course, but also if it's a check for to see if there's any choke risk, and just do a few back slaps. It's not going to hurt anyone. Before you proceed with your rescue attempt, check for pulse and CPR and so on, which I will talk about in a later episode. So the next one I want to talk about is foreign body removal from kids' nose. So kids, especially toddler, frequently try to put things in their nose, even their ears, and a lot of times you don't even know they did that. And then one day there's purulent drainage, pussy drainage coming from their nose, and they start complaining of having pain and so on. And then a lot of times, especially on one side of the nose only. So that's something that you have to think about possible foreign body being stuck up their nose. So there are a few different ways to help with this. And there's a technique called a mother's kiss. And you can also Google this too. So basically, say this is the side that you suspect there is foreign body inside. What you do is you have the mom or someone that the kids or the baby comfortable with, and a caregiver, and you block the other nostril, and you have the caregiver put their mouth on the kid's mouth, and you do a quick strong blow into their mouth like that. So what that does is activate a reflex that allow the victim or the kid, the toddler, to eject the foreign body from this side. So cover this side and then mouth to mouth, and then do a quick blow, quick forceful blow. So the reflex will eject the foreign body out. And you can try that a few times. And if that doesn't work, then obviously you bring the kid to urgent care or the emergency department. And it's not an emergency situation here, but it's an urgent situation because you don't want it to become infected. Then giving antibiotics and things like that will only treat it. Just it doesn't remove the underlying problem. So you still need to remove what caused the infection in toddlers. So you still need to remove it and you can send it. And then at the urgent care clinic, we do have what we call a CAS extractor where you put, um, it's a device that is long and then it, you can inflate the tip of the device. So you put it in past the foreign body ideally, and then you inflate the balloon at the tip and then you just pull it back. On my last attempt to try to do this, or one of the attempts I tried a few times, but the balloon could not pull the foreign body out. It's not that simple, even though the concept sounds good. But what happened is that the kid ended up sneezing and just ejected the foreign body. So sometimes even try to induce a sneeze on the other nostril, you may help the kid eject that foreign body from the nose. And if everything fails, we send the patient to the ENT the next day, and then they'll take the foreign body out without any problem with the called laryngoscopy, where they just put a camera up there and just retrieve it. Ticks removal, very common in the New England area this time of the year where they've been hungry all winter. So now they're coming out of the woodwork. And it's not the summer when they come out the most, but actually this cool weather, springtime, and also the fall when they start feeding. So if you have outdoor activities like camping, or those hunters, make sure that you make an effort to, especially if you don't have shower access, check for tick at the end of the day if you can. Because the longer they are stuck on you, the longer the risk of transmitting the Lyme bacteria to your system. So I think that the study showed that 50% of ticks are infected with the Lyme bacteria or a bacteria that can cause a tick-borne illness like Rocky Mountain spotted fever, Ehrlichia, and other tick-borne illnesses. So, but it takes about 54 hours to transmit that bacteria from the belly of the tick to our system. So the longer and the more engorged the tick is on you, the more likelihood of transmitting of the Lyme or tick-borne disease into your system. A lot of home remedies online, but I do not recommend burning method of Vaseline or alcohol because these ticks, they are survivors. These not going to kill them. And just because they're dead doesn't mean that they will let go or be released from your skin. So, and it can physically cause harm to your body. So it's not a smart idea. And you have to physically remove these ticks. And from several years of experience doing this, I think the best method is get a pair of tweezers and just wrap onto the tick right at the base as close to your skin where it attaches to as possible. And then just steady pressure and just turn like that slowly and then turn slowly again, one direction or the other, doesn't matter. You can turn one and then you can turn the other way too. So you can eventually loosen the grip of these ticks on you. But remember to be gentle because if you do too hard, then you break off their body from their leg that's stuck in your skin. So gentle pressure with the tweezers and go clockwise and then counterclockwise, close to the base your skin as possible. And it doesn't take long, but it does take patience to remove these suckers from you. Studies have shown that retained leg is are not harmful to you, but I've never seen a patient that not minding a foreign body in their skin, especially a part of a tick body. Always try to remove them all. And if there is a retained foreign body in the skin, you can just dig it out and then make sure that you clean with alcohol afterward, and then put some bacitrazine and then cover with Band-Aid, and your body will heal that area just fine. And sometimes in difficult case, I even inject some lidocaine and then numb and then use a blade to dig the tick out of the those are tips and tricks for tick removal. Button batteries, that's a danger because these can have mercury and other dangerous chemical in the system. So if there is suspicion of button battery injection in a child, study have shown actually you can administer 10 ml and just have them ingest the whole thing. So the honey supposedly will reduce the toxic effect of the buttonberry on the esophagus or the stomach. And after that, then take the kid to the emergency department and they will need an emergency GI referral or an evaluation so that they can do an endoscopy removal of the item. If left in there a long time or a few days, it can perforate the esophagus. And sometimes you can find on x-ray, it's called a double ring sign. So they said that if the battery passes the pylorus, which is a junction between the stomach and the small intestine, the risk is lower. And we need to observe the patient to make sure it passes what we call the ileocecal valve, which is where the small bowel meets the large bowel, because that's where things are narrow. So one that passes, it's likely that it will be pooped out by the victim or the patient. So it's harder to go in once it passes into the small bowel, especially the lower part of the small bowel. The endoscopy can only reach the duodenum, which is the upper portion, the small upper portion of the small bowel that is connected to the stomach. So bottom line is that button battery, 10 ml, 10 millimeter of honey, go to emergency department for referral, get some imaging tests done, and see whether the child is a candidate for endoscopy removal, or if already passed the pylorus, which is where the stomach meets the small bowel. Then one may observe and see to make sure that it eventually makes its way past the ileocecal valve, which is where the small bowel meets the large bowel, and make sure that it is passed by way of bowel movement. But battery, those are dangerous and can cause a lot of bad problems and time and stress. The next one is a two-magnet injection. The two-magnet injection, if the magnets get separated and come back together with the bowel in between, it can erode the bowel wall, leading to perforation and fistula. It is a rare event, and usually patients should be observed closely. Sometimes it's difficult to verify whether the child ingested the two magnets together or not, but that's something that you can see on x-ray usually, and you can follow the direction and make sure that they passed without any problem in stool. And you watch out for any sign of symptoms of problems such as pain, fever, nausea, vomiting. Your bowel activity is affected. So that's the problem with the magnet injection by children. So I will stop right here because we'll have more episodes later on more tips and tricks. But in summary, cooking sensation, make sure that you, in emergency and patient passing out, especially in a barbecue or outdoor setting where like the hot dogs being sold or sausage, think about choking on a victim collapsing without a reason. Besides cardiac arrest and other emergency, think about choking and attempt a few back slap to see whether you can help unlodge the foreign body from the larynx. You can save a life. And at home too, you can try the slapping technique. And then if that doesn't work, you can always go to the Heimlich technique. Foreign body removed from a kid's nose, we talk about a mother's kiss. Try that a few times and Google that if you're not sure about the way to do it. And then if not, then bring to the urgent care and we can make a few attempts before, if we fail, send it to ENT. Tick removal, talk about technique of steady pressure with the tweezer to turn clockwise and then counterclockwise. A button battery, the importance of using 10 ml honey to reduce toxic effects, and then take the victim to the ED to get emergency GI referral for possible endoscopy removal. Then lastly, tube magnet injection. Just basically wash, make sure that they don't stick together with the bowel wall in between, causing erosion of the bowel. All right, and there will be more coming, and I hope that you find this helpful. And if there's any tips and tricks that you would like me to share in the future, please let me know. Have tips and tricks of your own that help your family members in the past or your friends, then also please share with me. And thank you for taking your time to check in my podcast, and have a great day.